Vital improves a number of areas in your emergency department, inpatient, or urgent care settings. In the emergency department, we've seen a 30 to 50% reduction in left without being seen. That's people who are frustrated because the wait times are so long that they just bail. That's a $2,000 visit walking out the door, so there's a big return on investment there. We've seen a lower length of stay because we can use wait time as productive time. We've seen a 21% average reduction in emergency bounce back. That's where somebody pops back to the emergency room within 72 hours because the problem wasn't actually resolved. For inpatient, we've seen a 7% reduction in 30-day readmission. That's big because you get penalized for 30-day readmission. So those on the outcome side. The revenue side is really interesting because by making the discharge process easier, by using AI to help patients find doctors, you get 30 to 40% more specialist follow-ups than you would otherwise. Otherwise, people are just going to go to ZocDoc or they're going to go to a competitor. That's usually worth a few $1,000,000 per emergency department or inpatient setting. It's worth maybe about $500,000 to the urgent care setting. And staff satisfaction also improves. By taking burden off of your nurses, we've found at West Tennessee and a couple of other places that staff satisfaction has gone from the second lowest to the second highest after implementing Vital. And one health system actually attributes that to saving 59 nurses from otherwise quitting. I don't know what the value of that is from recruiting, but I've got to imagine it's pretty big. The one thing that I would want people to remember about Vital is that it is patient-centric, human-centric design, and that means that you have insanely high utilization. So on average, 63% of all patients in emergency or inpatient or urgent care use Vital. If you look at what, say, the EHR does or what other digital health vendors do, it's between like 8 and 20%. Because we touch the majority of patients, you can actually impact your outcomes. So I would say don't compare things feature by feature. Look at the actual outcomes, look at the usage, and honestly, at the end of the day, technology is just to serve a human need, a patient need, and a business need. So pay more attention to the results and the outcomes than the features.